this is a great testimony from Mr. Cooper to see how much we're able to do nowadays with the advanced technology and complex procedures. Back in the days, these kind of situations would be medically managed, and no intervention would have been an option. So there are a lot of patients out there like Mr. Cooper who could utilize this facility and this procedure. So I really appreciate Mr. Cooper coming on board to talk about his experience and how he went through this and how he is feeling now. I want to take this time to thank everybody involved in taking care of Mr. Cooper, my cardiac Cath Lab team, my other providers, great NPs like Taressa, who was there to help me out.
When we have these success stories, it's truly amazing. And what's really amazing is the team effort. And that's what this is they're coming together, the team, and emphasizing that the patient and the family is a part of that team. Because the communications that take place and the understanding of what technology is available, providing that technology, and leading to the best possible outcome for the patient. So that starts with the patient and the doctor and the providers and the industry with Abiomed, and then with ICU with the collaborative care that we provide, and even cardiothoracic surgery to really come together and find out what is going to be best for these patients.
Oh, thank y'all. I'm in the condition I am because of y'all, and I appreciate that very much. And the doctor that diagnosed me with ALS had told me that ALS doesn't hurt. So if you have, pain that maybe that's not the ALS, because the ALS doesn't really, hurt. And so I have had some back pains and that type of thing, but that's pretty much how my heart started. I thought I had a backache, and shoulder was kind of bothering me, and I had not had that previously. And this went on for about a week, and it kind of moved to where it was in my throat, kind of felt like I had a knot right in the middle of my chest. My wife and I had talked, and we agreed that we would, like Dr. Abraham, go ahead and do this, and did a great job. I have nothing but good to say about it. I mean, I have recovered greatly. I had no pain whatsoever. I mean, I expected to have some growing pain, or maybe some chest pains, a little bit, but nothing.
So Impella is a heart pump. It's the smallest heart pump available out there, and it's a catheter that goes into the main pumping chamber of your heart. And it essentially what it does is it takes the function of the heart during the time it's on. So it helps the heart to relax and be the most efficient, so that it takes away all the stress from the heart muscles. So whenever we do complex procedures like what you had, this machine actually helps us to keep the patient hemodynamically stable throughout the procedure. That way we can take our time and do the procedure in the right way. In your case, even though we use the stents, we essentially did a bypass on you with the stents. So we opened up all the blockages that you had. You had all the blood vessels in your heart had blockages. So we essentially did a bypass in the Cath Lab, and it took less than 2 hours, and you went home the next day. So that's the best part about it. So your recovery was essentially a couple of hours after the procedure, and you were all back to normal.
The option was open heart surgery, and with my legs not working, and if you can't use your arms, that wasn't part of my thought process, because there's no way I was splitting my chest. I couldn't recover from that.
I wish we would have known at the time that we were going to do this, so that we could have written down everyone's name to say this person did this and this person did that, because there were so many awesome people that helped him. We just appreciate it. And the fact that he is almost his old self again is wonderful.
When you come out and say your testimony, this is a message to all the other people who are probably like you, who were declined for surgery or could not be a candidate for surgery, and probably nothing was done. So I can see there are a lot of people out there who did not get the right treatment due to their comorbid conditions. So I'm really happy to see you, and I'm glad that you took this time to tell your story to everybody.
Well, we're always ready to act, and that's what's important, is having the team and the technology available that we can deliver it to the patients. And it's great to see you doing so well.
Thank you very much. Thank you very much.